Miscarriage, a heart-wrenching journey that affects millions across the globe. Here, we delve into the causes, risks, prevention, and more importantly, dealing with the aftermath of enduring this profound loss. Pregnancy loss through a miscarriage usually leaves an individual or a couple grappling with grief, guilt, and emptiness. Grace Njuguna is one such lady who, together with her spouse, faced a miscarriage during the onset of the COVID-19 pandemic.
Miscarriage is one of the traumatic experiences that I've gone through in life. Even to start with, it is something that I would never wish any woman to go through it. Even my worst enemy, I would not wish them to go through it. It's traumatizing. It's painful. It's actually among that day is among the worst days of my life. The pregnancy journey was good from conception up to 20 weeks. So I was 20 weeks on that day.
Even as Grace gives the account of her miscarriage, Dr. Agnes Wanjiku sheds light on the miscarriage and its major causes.
The word miscarriage is a term that is used commonly to refer to a pregnancy loss. A spontaneous pregnancy loss that occurs before a baby or a fetus is viable. When we talk about fetal viability, we are talking about a fetus who can survive if born at that particular time. Worldwide, the definition refers to a pregnancy which is lost before 20 weeks of pregnancy. Some of the signs that one can look out for if you have missed a period or if you have confirmed a pregnancy, any bleeding, it could be a sign of a miscarriage. Any pain in the lower abdomen could be a sign of a miscarriage. Backache or even fever could be a sign of a miscarriage, which is even getting an infection.
And true to this, Grace experienced these symptoms and swung into action, seeking all possible medical interventions.
When I was going to work, I had some pains, some cramping, but then I thought it's normal in the first trimester. It is normal to, actually in the second trimester, it is normal to have the cramping, it is normal to have pains. When I talked to my friends who I shared with, because it had begun on Friday, the cramping was mild, but now on Saturday it was an issue, it was now a concern. But people were telling me, and even some nurses that I talked to and some doctors, they were telling me it can be normal, but in case it increases, I go to the hospital. So when I went to work, I felt it is important that after work, I go to the hospital. While I was going, I thought it is just like any other visit. Ile ni kawaida tu nitaenda hospitali, nikuje nyumbani.
Once these symptoms have manifested, is there a chance of saving that pregnancy? Dr. Agnes explains.
Once a woman has confirmed that she's pregnant and she starts getting those symptoms of bleeding, for example, it doesn't always result into a miscarriage. So if someone can go to the nearest hospital or visit their healthcare profession, then they can be able to detect if these are signs of an impending miscarriage or just a threatened miscarriage. A threatened miscarriage is a miscarriage whereby there is that bleeding, yes, from the birth canal, but the pregnancy remains intact. That is a threatened miscarriage, and in that case, if you go to the hospital early, that pregnancy can be salvaged. But some may not be salvaged, because if you have already started expelling the products of the pregnancy, then we call it inevitable.
I called my husband, I called a certain friend of mine who is in Thika, I called my parents. My spouse came, and in a few, the best couple, they also came, and we agreed that we want to go to another hospital. When we asked we asked the doctor whether it is okay we go, the doctor said that she cannot allow us unless a gyna comes who will see me and allow me to go. Because to her, the way I was, actually alikuwa ananiambia wewe utapata mtoto kwa gari, hata hutafika hiyo hospitali.
Among the risk factors that lead to miscarriage is age, past miscarriages, and genetic problems.
We advise women to give birth early or to have children early, before 35 years of age.
Yeah.
And this is because over time it has been identified that women over 35 years have got an increased risk of miscarriages as well as pregnancy complications. Other risk factors for miscarriage are like maternal conditions. Somebody could be having a chronic illness like hypertension, which is not well controlled, and that can lead to a miscarriage. Other risk factors, maternal risk factors, could be maternal habits, like smoking, use of, we call them recreational drugs, like cocaine, even caffeine. Too much caffeine can cause a miscarriage. Then you could also have other factors of the mother, of the uterus, like a cervix which is weak. We call it cervical insufficiency, and one may have repeated miscarriages because their cervix cannot hold the pregnancy beyond a certain limit. Especially for cervical insufficiency, you'll find that the mother keeps getting miscarriages at 4, 5 months, 6 months, and until that is corrected, they may not have any full-term pregnancy.
Dr. Agnes also underpins on the preventive measures a pregnant woman can take to avert cases of pregnancy loss.
There are certain things that we encourage couples. Actually, before even a couple conceives, you are supposed to visit your healthcare professional and specifically visit your gynecologist, so that you can go through the genetic counseling, you can go through health education, so that if for example you are a smoker, you can be advised on discontinuing to smoking. If you take alcohol heavily, you may be advised to reduce on alcohol intake. If you take drugs, for example, then it will be nice to visit your doctor and be told how to prepare yourself for a pregnancy.
A miscarriage usually causes a ripple effect in the life of an individual or a couple. How did the miscarriage affect you as a couple now?
Well, I would say there was no drift between us because, as I said, he supported me in his capacity. Yes, I felt that he didn't stand with me like I would have wanted, like any other wife or woman who has gone through it, but then he was in school. Na pia ninaangalia venye ameenda shule, it is for our good. So tunaweza kuwa pia tuna sacrifice. I'm going through a lot alone now, but he's sacrificing also for our future. So in his capacity, he gave me the best, and even wherever he is right now, I appreciate him for that.
Dr. Ruth Kamunyu, a lecturer and counselling psychologist, explains why couples may grow adrift, especially when trying to come to terms with a pregnancy loss through a miscarriage.
Mostly it will happen because probably they don't understand the different ways of coping. Because a woman may cope differently, and a man may cope differently. So acknowledging that probably I have my different ways of coping. Like probably a man may cope by even just being outside there. He wants to be outside there with others. That's his way of coping. He may be out, maybe he may choose to read books. He may choose to indulge in his hobby. He's looking for different ways of coping, which the spouse may not really understand.
One of the most important part of the whole process is acceptance, because from it, an individual or a couple can seek the necessary support. Dr. Ruth Kamunyu emphasizes on the importance of addressing the emotional and psychological trauma resulting from a miscarriage.
Professional counseling is also important, because when people go through that ordeal, it's actually an ordeal because it affects somebody. One gets emotionally drained. Besides the physical scars, the miscarriage affects one physically. There'll be some changes in the body. But besides the physical scars, the emotional consequences are actually far-reaching. And it has been said that people heal, they heal physically, but then emotionally, it could go for even years if they do not seek for any form of help. So as counselors, we insist on both physical and emotional healing it's also important.
But what if an individual shuns professional help and decides to go it alone?
It could take long to heal, and they could adopt some probably coping mechanisms that could affect them later in life. As I have said, it can take years to heal. So somebody may take a different route and adopt some coping mechanisms, probably that are meant to make them forget. And in loss and grief, there's nothing like forgetting. It's about coming to terms with what has happened.
It remains important to work with somebody who understands, as Dr. Ruth puts it.
Grief is not a one-day thing, yeah? And healing is not a one-day thing. It's about walking with somebody. In counseling, we call it walk with somebody who cares, who empathizes, who listens, who will give the right information, and who will be by your side as you try to negotiate that stage, because it is a painful stage.
People find it hard to talk about miscarriages, ostensibly because of the cultural beliefs, something that both Dr. Ruth and Dr. Agnes acknowledge.
People also fear the stigma. We are living in a stigmatized society. People face a lot of shame, a lot of guilt, a lot of self-blame. So to avoid all that, some people opt to just go it alone.
Maybe we already stigmatize ourselves, and possibly you don't want to talk to other people about your misfortunes, because a miscarriage is regarded as a misfortune. So it's possibly just because of our culture. It has nothing to do with anything else.
The effects of miscarriage do not only affect women, but also men. However, the difference comes in the way a man would handle the emotional effects, especially because he is supposed to show up for the spouse.
So for the men, it's also good to really be able to express their feelings. And this is one thing that us counselors encourage the men to do. Unfortunately, the way men are socialized, they are socialized to be heard. So they try to shun away, the feelings. But it is always very, very important to be able to express your feelings in whichever way you can. They may not express it like the women, but in a way, be able to deal with your feelings, because there's some pain also. This was your child, you are waiting for it, and probably you had started seeing signs of the baby coming. You're also preparing yourself as a father. It's not only women who prepare themselves as mothers. Men also prepare themselves psychologically, the baby is coming. Even that aspect of being called a father, at least I have fathered somebody. So emotionally, they also get affected.
Overcoming the fear of conceiving again is a factor that speaks to the hope of carrying another pregnancy to term. Having lost one pregnancy already, how did Grace overcome this fear?
My gyna gave me a lot of confidence. Then I walked with him in the journey until nika conceive the McDonald stitch. He was also with me. So about now the fear, I didn't have much fear, because I had someone I would talk to, someone I would visit in the hospital, someone I would even call. Then the other thing that made me not to fear, it is because after I miscarried, there are so many people who came to see me. I remember my pastor came to see me together with one of the elders in the church, pastor's wife, and other women in the church, and also friends around Katondo and Nairobi. They came to see me. So it happened that there are 3 women who came to visit me who have gone through the same. So they encouraged me. I would see that they have even children after they have gone through it. So it gave me hope.
The motivation to talk about the effects of miscarriage is usually not there, but Grace is determined to break the silence and let people know that it is okay to talk about it.
There are 2 major reasons that encouraged me to talk about this today. And the first reason is to break the silence of pregnancy loss and even what women go through after miscarriage. Because one thing that I know is that miscarriage is not taken seriously. After miscarriage, as a woman, you're expected to move on. You're expected to bury what has happened. You're expected not to say about it. Actually, what I've come to know is that 4 women, 1 woman out of 4, they have gone through miscarriage. But people, they hide. people don't have the confidence to talk about it. The second thing, I wanted to glorify God as I share this story, because what has happened to me after this, it's a testimony, because now on December 2021, it has happened in 2020, on December 7th, 2021, now I was blessed with my firstborn, Ezra, who was born as a preterm baby. Then 2023, December also, 18th, I was blessed with a girl. And one thing that I always used to say is that God will restore me, that God will restore the pain that I went through, that God will restore that girl. I used to believe that.
One question that may linger in the minds of those who have experienced miscarriages remains: is there hope?
There is hope even for couples who have had miscarriages, and even if you've had like 3 consecutive miscarriages, the chances that you will have a full-term pregnancy are still high. About 60 to 80% chances of still having a full-term pregnancy. And of course, the most important thing is to identify, is there a cause of these miscarriages? If there is, for example, cervical insufficiency, that can be corrected. If there is a uterine defect, it can be corrected. If it's the maternal conditions that have not been well controlled, like diabetes, hypertension, or thyroid disease, that can be corrected. If there are infections that have not been treated properly, then that can also be corrected. So the most important thing is to identify whether there is a reason or a cause or a risk factor in the couple.
Dealing with the aftermath of a miscarriage is usually a journey traveled in silence. In such wake of profound loss, emotions and feelings can become overwhelming, and that may leave an individual or a couple feeling isolated or adrift. And in the midst of all this, there is hope and light at the end of the tunnel.